Hi, my name is Shannon Blyle, and I want to thank you for watching my presentation for my capstone on diabetes in Nebraska. Diabetes is the public issue I chose, and it's a chronic disease that involves high levels of sugar in the blood. There are 3 different types of diabetes, including type 1, which is insulin dependent and most likely occurs in childhood, type 2, which is non-insulin dependent and is most likely caused by lifestyle factors and environmental, and type 3 is gestational. This often occurs during pregnancy. In the United States, diabetes is considered to be an epidemic. There are approximately 34 million Americans living with diabetes. In Nebraska, that percentage is also high, with 8.8% of adults living with diabetes. Another problem with diabetes is that often it can go undiagnosed. So in Nebraska, there are approximately 44,000 people with undiagnosed diabetes. This can include people with low income or other vulnerable populations that do not have access to healthcare or a doctor or insurance and aren't able to get to see a doctor to treat their issue. Socioeconomic status plays a big impact in diabetes. For example, if a person is low income, they most likely don't have health insurance or a job and aren't able to see the doctor regularly. On the other hand, if a person does have health insurance, the cost of diabetes can be extremely expensive. There are many test supplies to buy, your insulin, your other supplies. So it can be a very expensive disease, and that is often crippling for people. Education level also has an impact. If a person hasn't gone to high school or college or anything beyond college, they may not know the importance of exercising and good diet and getting enough sleep and not being stressed, that they may develop diabetes and not even know it. So I chose this as my public issue because, like I said in the last slide, it's a nationwide epidemic and 34 million Americans are impacted by it. During my clinical rotations, I saw many patients with diabetes and the impact that this disease had on their health progression and their ability to get better. There was many people that their treatment plans and nursing interventions had to be adapted due to the fact that they had diabetes. I also chose this because I am pursuing a nursing degree, and in my future practice as a nurse, there will be many people that I will treat that have diabetes. So I wanted to do a deep dive to learn more about it. Next, I'm going to talk to you about my educated citizen experiences. And the 3 goals for the educated citizen are being an effective communicator, a reflective individual, and a change agent. So I will explain how I used all of these in my clinical rotations and how that has impacted my education. So first, we'll start with effective communicator. My first experience that I'm going to talk about was when I was in the ICU and we had a patient admitted for stroke-like symptoms and who was not responsive. So she wouldn't respond to touch, to pain, or to voice. So on day 1, I worked with her 2 days in a row. So on day 1, my nurse made sure that we were talking to her, even though she wasn't responding and wasn't acting like she could listen. My nurse said that she could hear us. So we made sure to talk to her and give her updates to what we're doing. So anytime we give her medication, we tell her, oh, here's your Tylenol, here's your feed and your feeding tube, things like that. So then on day 2, she actually woke up and was able to respond to us. And I think that really made an impact on her because she had heard our voices the day before and we were able to communicate with her, and she felt more at ease with us because of what we did the day before. So I learned from this that it's important to treat every patient with dignity and respect, because even if they're not responding, they still know what we're doing and what we're saying to them. So it's important to never talk badly about them while you're in the room, not to talk about other patients while you're in the room. And then I also learned just the benefit of communication. Because we did this, she was able to feel more relaxed and more at ease that next day. And then to tie this into my public issue, when working with patients with diabetes, it's important to treat them equally and without judgment. There are often times that people who are obese, people just think they're not healthy and that they just, eat fast food for every meal. So it's important not to judge them and to kind of dig deeper and help them without judging them. You never know a person's circumstance. So it's important to build that relationship and communicate effectively with that person. So my next effective communicator was when I was in the labor and delivery department. So we had a patient admitted for her second C-section. She has a 2-year-old daughter at home, and she was super nervous for this procedure. And she was actually started shaking. So with this, I did my best to comfort her, to talk to her, to get her mind off things. And we made sure to repeat all the information numerous times because this was her second C-section, but because she was so nervous, we wanted to make sure that she had all the info she needed. So I learned from this that communication can have a huge impact. Just sitting there and talking with her, you could tell her mind kind of was put at ease and she kind of relaxed and felt better. So it showed that communication can have a really big impact. I also learned the importance of repeating the information. Like I said, she had this procedure done, but we helped her out by repeating it so that she didn't have any questions and felt comfortable with the procedure. And then with this, it's also important to realize how you communicate. So to make sure you're using a calm voice, using positive body language, and giving any handouts or written information that might be helpful to them. To tie this back to my public issue, I'll always think about the impact of communication. So just taking time to talk to the patients with diabetes about what they eat, how much sleep they're getting, and things that can help make them healthier and make them live a happier life. Sometimes just talking can make all the difference for them. And next we'll move to reflective individual. So my first experience was when I accompanied a patient to the GI lab for an ERCP, which I have listed out there. She didn't speak English. She actually spoke Russian. So we used the interpreter system for that. And during this procedure, I was able to stand with the nurse that was charting, and he kind of took me under his wing and was telling me all about the procedure, and I was able to ask questions and understand further because this was my first time being in the G Lab. So it was a really unique experience. I learned the importance of being inquisitive and asking questions. There's no way to learn if you don't ask questions and seek to know more information. So I asked him, once they get the stones out of her pancreas, where do they go? Do they suction them out, or how do they pass? And so he did a good job of explaining everything. And it's also difficult to learn if you don't speak up and ask questions. So I will take that into my future practice and always ask questions and be inquisitive. And then to tie this back to my public issue, I will critically think about and analyze the problem I'm faced with. So if a patient has diabetes and they don't have money for their test supplies, then I could, look at other resources to provide them, or different, grant funds or scholarships to help them afford those supplies. And then if I'm not able to figure it out, I will definitely ask for assistance from others. So that way we can give the patient the best outcome possible. And then my final reflective individual was, again, in the labor and delivery department. So we had a patient that was admitted, she was being induced. This was her second baby, and she delivered really quickly and then began showing signs of postpartum hemorrhage. So my nurse tasked me with taking care of the baby after he was born. That way she could tend to mom fully. So she told me to do vitals every 15 on the baby to make sure he was pink and not, his lips weren't blue or things like that. So from this, I learned the importance of completing those assigned tasks accurately and thoroughly, because this was a newborn baby. So those first set of vital signs were super important to have accurate. That way we knew the health of the baby and knew if we needed to perform more interventions. And in this, I learned the importance of advocating, because the nurse called the doctor numerous times and really wanted to make sure that she would get in there to stop that postpartum hemorrhage so that it wouldn't get worse. And then at the end of the day, I think it's important to reflect on your day as a nurse and to think about the things that went well and maybe the things that you could improve on. And then to tie this back to my public issue, I would ask the patient relevant questions to better understand their care, and then to provide resources to help with those. So like I said before, if they don't have money for their test supplies, maybe to figure out how to get them those for free or reduced rate, and then to advocate for them and talk to the doctors or other staff if the patient needs more assistance. And then moving into my change agent. So the first experience was when I was at Madonna, and we had a patient that was admitted at the end of the shift, and he was in a lot of pain, and the nurse wasn't able to give him pain medication because he wasn't fully admitted, so there wasn't an order. And so she did her best to get him admitted as quickly and safely as possible, and then she called the doctor a few times to get him to put in that order and to get him to come see the patient so he could get that pain medication. So I learned in this situation the importance of assisting the patient in any way that you can and using initiative to make those changes and advocate. So she was very adamant about calling the doctor and making sure he came to saw the patient so the patient could be more comfortable. And then to tie this back, in working with patients with diabetes, it's important to use cultural competence to provide them the best care and assist them. So, making sure that you understand if they're, from an Hispanic background, or like the patient I had that only spoke Russian. So using the interpreter, making sure that we're able to help them efficiently and make them feel comfortable. And then my final change agent was when we had a community day for the 712 initiative in Council Bluffs. So we did a lot of garden cleanup, and we helped make their garden look nicer so people would be more apt to come use it and to benefit from it. So in this, I learned that being a change agent sometimes happens behind closed doors. So we didn't have any patient or participant interaction. We just did this on our own time. And so it was kind of nice to, work hard and make those changes so that people would notice that we were there and were helping to clean up. And then to relate this to my public issue, it's important to analyze the situation and brainstorm the best process. So we had a whole group of students, and we all got together and figured out, okay, if 4 of us work on this project and 4 of us work on this project, we can get the most done in the most amount of time. So it's important to, use each other to make a big impact. And then finally, I've learned the importance of being an educated citizen and incorporating those values in my everyday life. Being an effective communicator helps with patient care, it helps with safety, and it helps with better outcomes. Being a reflective individual helps prepare you for the future. It helps build your confidence in what you do well and helps you determine areas where you can work on things to get better. And being a change agent helps just to make change, to think about culturally and spiritually and mentally how these patients, how they're doing in the hospital and what you can do to make those changes to help them have the best day possible. Throughout this program, I've learned the importance of prioritizing time management and other skills. It was a fast-paced program, so it was good to learn time management because as a nurse, it's very fast-paced and you have multiple patients. So it's important to prioritize and time manage to make sure you get all your cares completed for the day. And I want to conclude by thanking my instructors, classmates, and Nebraska Methodist College for making this experience so amazing and for helping me to become the best future nurse that I can be. Thank you.